Good afternoon, Chairman, Co-Chairman, and dear distinguished guests. My name is Vit Kotheeranurak. I'm from Somdet Nasirasha Hospital, together with Dr. Akawan from Naresuan University and Professor Jin Sung Kim from the Seoul St. Mary Hospital. We'd love to present you a comparative analysis of the intervertebral disc signal and annulus changes between day 1 and year 1 after the transforaminal endoscopic discectomy. No conflict of interest of authors. So as we all know that in dealing with the lumbar disc herniation, the gold standard is the microdiscectomy, whether they do the tubular or open. But nowadays, the transforaminal endoscopic discectomy or TED is gaining more popularity. Its rationale is like to minimize the soft tissue trauma and to the target of the disc herniation. So what about the annular remodeling after discectomy? So will it heal by itself, or can it, like the protrusion immediate after surgery can reduce in the size? So come to our objective of the study was to investigate the annular remodeling and the intervertebral disc signal changes between immediate and 1 year postoperative MRI after the TED. We conducted a retrospective review of data reviewed by 2 spine surgeons with the single level lumbar disc herniation that underwent the TED in a single institute between 2015 to 2017 with a minimum of 1 year follow-up. The inclusion criteria were patients aged 20 to 60 years old that underwent the single level TED, which completed the immediate postoperative and 1 year follow-up MRI. The exclusion criteria were any patient with previous lumbar spine surgery at the index level, the recurrent lumbar disc herniation at the index level during follow-up period, or any sequestered disc. We collected demographic data, clinical parameter, and the radiographic parameter, mostly the MRI. We measured the disc height, residual mass, signal change, and the disc herniation grading according to Michigan State University or MSU grading, the disc protrusion size, and the spinal canal cross-sectional area. Of the 31 patients, the mean age is around 40 years old. 20 were male and 8 were female. L4 and 5 was the most operated level, followed by the L5 and S1. The first MRI means the first MRI day is around 1 day, and the follow-up MRI is 375 days. For the clinical outcome, only ODI, that is significant decrease between first follow-up and the last follow-up. We measure the MSU grading. You can see that at day 1, mostly they are at grade 2 and 3, which is behind the facet joint on the picture on the right. And at 1 year, it reduced to no herniation or grade 1. So we observed that in 5 patients, no MSU grading was changed. And we measured the disc height. The mean height loss is around 8.4% in 1 year. And the disc protrusion size, this is how we measure. You can see that preoperative, day 1, and the year 1. The disc protrusion size reduced 67.7 in 1 year, and as well as the spinal canal cross-sectional area, which is increased by 32.1% at 1 year. For the residual mass signal, at day 1, mostly they are immediate to high intensity, but when we follow up at 1 year, the high intensity tends to be intermediate to low signal intensity. When we correlate with the clinical, only residual mass signal at day 1 and the disc protrusion reduction, that is correlated with the ODI at the last follow-up. So when we did the multivariate analysis, only disc protrusion reduction, this is statistically different. So for discussion, Nakano in 2001, they studied the microdiscectomy and the pattern of residual mass that is correlated with patient symptom. These pictures is from their paper, preoperative, 3 months, 6 months, and 1 year. But in our study, the percentage of the residual mass reduction correlated with the final ODI. And Weber in 2016 in Spine, they found that the high signal intensity in T2 MRI at 1 day or 24 hours correlated with the reduction of the residual mass at 3 months. But from our study, increased signal intensity at immediate postoperative or day 1, we found that it correlated with the lower disc herniation grade at 1 year, less disc protrusion at 1 year, and a higher percentage of the residual mass reduction. For the limitations of our study, first of all, is the retrospective review, which cannot show the causal effect, and the different cuts between the first and the last MRI, and the time of in the interval of the MRI were not done at the same time. To conclude, after 1 year, 83.9% of the remaining annulus remodeled with a 67.7% decrease in protrusion. The higher signal intensity of residual intervertebral mass correlated with the percentage of the protrusion mass reduction. And the last, the disc protrusion reduction percentage correlated with the ODI at the final follow-up. Thank you for your attention.